your hosts, Eric Napoli and Destiny Daly. In this TED Talk, we will discuss the disorder Fragile X syndrome. Fragile X syndrome is an inherited genetic condition which causes mental retardation. This syndrome occurs in 1 in 4,000 males and 1 in 8,000 females. This mutation occurs in chromosome 23, but is located on the X chromosome. A mutation on one X in females is sufficient enough to cause the disease. However, the effects may not be as severe or may even go unnoticed. Since males only have one X chromosome, the effects tend to be more prominent, making this a sex-linked dominant disorder. Dominant means only one parent needs the gene to pass the disorder down to their child. Common symptoms of the Fragile X syndrome are development delay in the child being presented, poor eye contact, hyperactivity, continued repetition of words or phrases, short attention span, double jointedness, responds negatively to touch, large or prominent ears, hand flapping, large testicles, hand biting, and a family history of development delay. There are several physical features commonly associated with Fragile X syndrome. Not all children will be exhibiting these features. These features also appear in some children without Fragile X syndrome. The primary physical feature that people associate with Fragile X syndrome in boys is a long face and prominent ears. These features often become more apparent after the age of 10. There are a number of physical characteristics of persons with this syndrome that are associated with a connective tissue alteration. This includes double jointedness. This means that one has a joint that appears to be unusually flexible. Both boys and girls may be more flexible than normal. They would be able to hyperextend their elbows, fingers, or thumbs. Some may be able to bend their knee joints backwards. Macroorchidism, enlarged testicles, is a common feature in adult males who have Fragile X syndrome. Some boys will have it before puberty. After puberty, nearly all males will have testicles that are bigger than those of typical normal males. Other clinical features and body structure that one may find are macrocephaly, a large head circumference, a broad forehead, and a prominent jaw. Where there is a problem with the loose connective tissue, one may find flat feet or scoliosis. Some children exhibit low muscle tone, thickening of a heart valve, hernias, and a crossed or lazy eyes. For females with the disorder, they may share some of the boys' features, but to a lesser degree. The behavioral aspects are similar to autism. In certain situations, the environment will influence a child's behavior. Here are a bunch of examples. For a sensitive infant, they do not like to be held or cuddled. They avoid touching certain textures of material such as blankets and stuffed animals. They're distressed by clothes rubbing on the skin. They refuse to walk barefoot on grass or sand, often walks on tiptoes only, and they're excessively ticklish. In social situations, they resist being friendly or affectionate touch, dislike kisses, and will wipe off the place where they were kissed. They appear fearful of or avoid standing in close proximity to other people or peers. They avoid group situations for fear of the unexpected touch. In play situations, they avoid using hands for playing, dislike or avoid messy play in the sand, mud, and water, and are distressed by dirty hands and want to wipe or wash them frequently. In daily living challenges, they complain about their hair brushed or may demand a particular brush, resist having hair, toenails, or fingernails cut, which causes distress, resist brushing teeth, resisting trying new foods, only eat foods with certain tastes and textures, and mixed textures tend to be avoided as well as hot or cold foods. And they are bothered by rough bed sheets, refuse to wear particular clothes with rough textures, have adverse reactions or avoidance behavior and respond to wind blowing on the skin or water from the shower, and they overreact to minor abrasions.
In order to understand the causes of Fragile X syndrome, first you will need to understand basic definitions. First is the fragile mental retardation 1 gene. It can be found in almost every cell in the body, and its function is to create the FMRP protein. The FMRP protein is a protein essential for normal brain development. A triplet is a sequence of amino acids and a protein that determines its structure and function. A premutation produces a normal individual, but it can become a full mutation in subsequent generations. The mutation in the FMRI1 gene, a gene used for making the protein FMRP, is what causes the Fragile X syndrome. The function of the FMRP protein is to aid in the development of other proteins and in the development of synapses. The synapses are specialized connections between nerve cells. The triplet CGG is repeated an abnormal amount of times in the FMR1 gene, causing a mutation. In a normal person, the triplet repeats 5 to 40 times, and in a person with Fragile X syndrome, it repeats over 200 times. A person whose CGG triplet repeats 55 to 200 times has an FMRI1 gene premutation, which means they may have some of the same physical features as a person with Fragile X syndrome and may show similar behavior to a child with autism. The abnormal repetition of over 200 times silences the FMR1 gene and disrupts nervous system functions due to the loss or shortage of the FMRP protein. The inability for the nervous system to function correctly is what leads to the signs and symptoms of the Fragile X syndrome. Although there is no cure for Fragile X syndrome, there are steps that can be taken in order to mask the effects of it. First, a child should receive the appropriate type of education. It is important that they have the right type of education, or else they won't be able to reach their full potential. Also, people around the child should be educated on the disease in order to make the child more comfortable. It is better to use these methods when the child's younger so that the problems can be addressed while the brain is still developing. In females, the disease may have little to no effect on them, so these methods may not even be necessary.